It's all about community and being here for each other. Dr. Gerardo Rodriguez-Menendez, talked about community, has held a broad spectrum of responsibilities in education, administration, research, consulting. He served in many roles in universities, Chancellor University, Dean of Colleges of Psychology. He's done clinical psychological practice and private practice consultant, focusing on organizational leadership. He's currently the chair of the Master of Clinical Psychopharmacology at the Chicago School of Professional Psychology, and an ardent advocate for prescriptive authority for psychologists in Illinois and around the country. Dr. Rodriguez-Menendez serves on the board of directors of the Illinois Association of Prescribing Psychologists. He's been a tremendous partner to me and to all, many of us here in this room. Dr. Rodriguez-Menendez.
Thank you so much, Beth. And good afternoon to all of you. This is truly a wonderful day. And so then, our nation truly suffers from many maladies and many types of disparities. And I know that I am speaking to the choir when I say that there's a critical need for educating psychologists to become prescribing psychologists to help meet those particular disparities. We know that study after study, whether it's conducted by the APA, whether it's been conducted by the NIH, whether it's conducted by NAMI or even the American Psychiatric Association, all find that there are barriers to accessing mental health services, particularly among our vulnerable populations, our minorities, and also the economically disadvantaged members of the white mainstream. We believe that individuals who are poor should not only have access to mental health services, but they need access to quality mental health services. I would also like to mention the fact that it's very clear that the public welfare will always be our primary concern. As psychologists, that is why we do what we do. Now, as an educator and chair of a program, I will tell you that secondarily, I'm also concerned about the viability of our profession and what is happening to our students upon graduation, many of whom incur debts that are very similar to graduates of medical schools. And so in the last 8 years, the number of students studying health service psychology has decreased by about 12%, just in the last 8 years. So obviously we have to find new avenues, and I don't think that psychopharmacology is the answer to all, but I certainly think that it will be helpful to our students in the future in maintaining a viable practice. Now, I also want to say that at the Chicago School, we are creating tomorrow's psychologists today. And I'm very pleased to mention that this past July, we had our first graduating cohort, and that cohort had 3 licensed psychologists and 6 doctoral students graduate with their MSCP degrees. So this thing, pre-doctoral training in clinical psychopharmacology is no longer a theoretical model. It is reality. Now, in the moments that I have left, I could not sit down without saying a few words about our hostess with the mostest, Dr. Beth Romreimer. Now, everyone who has worked with Beth knows that she is a dynamo. She is a legislative wizard, and she's a key leader in the profession of psychology. But I also want you to know that our dear friend, Beth Romreimer, is also very humble. Beth has quietly gone about creating the Beth Reimer Scholarships. These scholarships provide to 9 lucky recipients $5,000 apiece to help defray the costs of their education in clinical psychopharmacology. I'm also very pleased to state that in the past 2 years, 8 students from the Chicago School Clinical Psychopharmacology program have received Beth Reimer scholarships. Beth Reimer is clearly a great friend of the profession of psychology and also of the Chicago School. And so I would just like to thank you for your kind attention, but please do join me in providing Beth with a resounding round of applause.